Imagine you are in your OPD and a patient walks in with some symptoms, for example, chest pain, cough, shortness of breath, and fever. You took the history, did your clinical examinations, ordered a chest x-ray, and you diagnosed him as a case of community-acquired pneumonia. Now, as a treatment, you want to start antibiotics. But the dilemma is, should you admit this patient in the ward or treat him at home? The patient says, "Sir, I'm fine, I will take medicines at home, and if anything worsens, I would come back." Even though he's saying he's fine, your clinical instinct is telling you that he won't do well at home and he needs admission. So how will you solve this problem? How will you come out of this dilemma? So here comes the role of CURB-65 or CRB-65. These are objective structured framework that help you determine the severity of pneumonia, as well as it helps you decide whether the patient needs admission or not. So in this score, you assess confusion, level of urea, respiratory rate, blood pressure, as well as the age of the patient. Each positive finding scores 1 point. The CRB-65, it is a modified version. In this score, you do not require the levels of urea, and that's why it becomes easier for you to apply it in your OPDs, because you do not have blood reports all the time in the OPDs. Now the clinical application is, if this score is 0, the patient can be treated at home. If the score is 1 to 2, it suggests admission. If the score is more than 2, then the patient might need an ICU admission. I know you often forget these scores, but let me tell you how to remember this. Simply remember that if any of the parameters is positive, the patient needs admission. And if more than half of the parameters are positive, the patient needs ICU admission. So the next time when you are uncertain, simply apply these scores and you will find your answer. So that's all for today. See you in the next video.